You're listening to the Beyond Measurements and Image podcast, where we build healthier lifestyles, elevate your well-being, and transform lives. Welcome to BMI.
I'm your host, Dr. Drew Crawford. I'm a board-certified gastroenterologist and obesity medicine specialist. Thank you for joining me today on the Beyond Measurements and Image podcast. Today, we're going to have a conversation with Dr. Britt Morris. Dr. Morris is a good friend of mine. I've known him for about 30 years now. We were classmates. He's a vascular surgeon, and he has an interesting path to health and wellness. When we think of a health journey, we often picture gym routines, balanced meals, and strong sleep schedules. But the truth is, health is so much more than what we eat or how often we move. Sometimes a health journey isn't about six-pack abs or salad bowls. Sometimes it's just about survival. It's about fighting your way out of the darkest places, addiction, illness, hopelessness, and learning how to live again. In today's episode, we're stepping into one of those deeper stories. My guest opens up about his personal battle with addiction, how it started, what it cost him, and how his health, both physically and mentally, reached a breaking point. But this isn't just a story of struggle. It's a story of resilience, recovery, and rediscovery. Because whether you're trying to run your first 5K or you're trying to make it through the day sober, you're on a health journey, and every journey matters. Let's get into it. Britt, thanks for joining.
Thank you, Drew. Thanks for having me on the show. I'm honored to be here and grateful for the 30 years of friendship that you've given me. Like you said, we met in medical school back in 1992, so that seems like a long time ago. It's a little bit ironic that we're on a health and wellness podcast because my story drifts into unhealth and unwellness for many years of my adult life, following our years in medical school. Like you said, I was a vascular surgeon for a number of years. Currently, I'm retired due to some medical issues and also due to issues with substance abuse.
So, Britt, let's go back to your childhood. Let's just start when you want to start and kind of step us through it.
Okay. Well, I grew up in a small town in southern Oklahoma. Mother and father who were married for 58 years until my mother passed away in 2022. I had a younger brother who was 4 years younger than me who died in addiction due to a drug overdose. I'm currently sober now. I've been sober around 27 months. But my story really begins when I was a teenager. Those are the first years that I became aware of the fact that I was kind of what you would call a late bloomer. Matured a little later than most. I had a difficult time being comfortable in my own skin, I guess is a good way to put it. When I was 13 years old, I had a very strong Christian background and a strong faith. At that point in my life, I became aware that maybe that was where my life would lie, was in the faith in some way. But I was hesitant because there was something in me that led me to believe that I might be missing out on something later on, something maybe the world had to offer. And when I was 13 years old, I didn't know what that was or what that might be. I didn't really know much about women. I certainly didn't know much about drugs or alcohol at that point in my life. And that didn't change much over the next 4 or 5 years. But once I got out of the house, went to college, the world changed for me. Became acutely aware in college that I could at times be who I wanted to be and present myself in a way that I wanted to be perceived. It was a very unusual time for me. I started learning to do something what I call compartmentalization, which means that I behave differently with different groups of people. I put a mask on for certain groups of people and took that mask off for others. In the culture we live in today, sometimes that's celebrated. We celebrate those that compartmentalize things well. For me, it was a very dishonest way to live. I didn't know what that meant at that point in my life. I just knew that I was always changing the character I played. And that's when I really discovered alcohol. Alcohol became a social lubricant for me. I liked the way it made me think of myself, and I liked the way it made me think I thought others thought of me. And so I could change the way I felt by ingesting alcohol. Later, that morphed into drug use as well.
How old were you when you had your first drink?
I probably had my first drink when I was around 15 years old. That was a sip of beer, or it was largely inconsequential.
Yeah.
When I really first started to drink was when I was 18 years old and I was in college.
Looking back, so you say when alcohol made you be able to present yourself the way you wanted to be seen. How did you want to be seen that you weren't? What did you feel that you weren't presenting to the world that you wanted to show the world?
Up until that point, I'd been kind of a late bloomer. So I started to mature a little bit later than everybody else. So that was part of that process. But I was a quiet kid, a little bit on the shy side. I wasn't comfortable conversing with women, wasn't really that comfortable meeting new people. So alcohol lowered those inhibitions and made it easier for me to do that. It made me more conversational in awkward situations. And it made me at least think that I was a more confident, better looking, more well-adjusted individual. I was a very average high school student. By the time I got to college, I'd become a much better student, so that gave me some confidence. I was an athlete, played on a college tennis team, but alcohol enhanced a lot of my social awkwardness or social shyness, and I like that.
I would have met you probably about somewhere around 5 or 6 years later after you were 18, right? Probably 22, 23, somewhere in that area is where we met. Of course, on a podcast, you can't see Britt, but Britt is the typical alpha male, right? He's not the guy that's unconfident. He's everything the male archetype is, right? He's 6'6", he's big, he's athletic, he's a surgeon, he's all those things. So to hear him say that he struggled with confidence is difficult to believe. It's just proof that we really don't know what people are going through in life. We know from what they say that, women like tall men, and of course they like the surgeon, right? And there's all these stereotypes, but the reality of it is we're all cut from the same cloth, and we all have the same inner workings and strengths and weaknesses. So when you see such a strong human as Britt has projected, and if he struggled with these things when I knew him, to my discredit, I did not know that. I did not recognize it. I don't know that it was going on, and we'll find out today. As a good friend, I should have known, but I didn't. And it's just interesting to see. And I think it's a point that we all should absorb that, we're all in this together, and we have our inner demons that we have to fight, and we really need to be there for each other.
That's well said. I spent about 5 years in college, and my drinking progressed. It morphed into some drug use, first marijuana, and then things much more sinister. Once I figured out how to manipulate the way I felt using substances, whether that be drugs or alcohol, many times both, I learned that I could manipulate women in a similar way. So I was sexually promiscuous throughout college. My lifestyle led to consequences, but I learned in hindsight that consequences aren't really consequences unless you stop and acknowledge that they're consequences. For example, I was arrested a few times. I was responsible for a couple of unplanned pregnancies, which led to a couple of unplanned abortions. Something I didn't take into account and didn't fully acknowledge and deal with emotionally until I was 53 years old. Bear in mind that this happened when I was around 20 years of age. Consequences were there, but I just didn't acknowledge them. And I just kept going, pretending like they didn't happen at the time. But I also learned something in college, which I continued in medical school, was that I learned how to con people. And what I mean by that is that the people that were closest to me, like my mother and father, they didn't approve of my lifestyle, and they didn't approve of a lot of my choices. But they tended to let things slide because I was a good student, made good grades. So they said, well, he's living a lifestyle we don't approve of right now, but he's making good grades. He's trying to go to medical school. So we'll leave him to his own devices for now. I had friends that did that for me, but this wasn't them letting something happen. This was me kind of, in essence, conning them into trading my poor lifestyle choices and then not accepting it, not approving of it, but not making a big deal about it simply because I was a good student. In hindsight, that was a mistake on their part and as well as mine. As college progressed, with the exception of the above stated consequences, things went well. I eventually did get into medical school.
So prior to going to medical school, you were in college, you were on the tennis team. Tell us about your general health and wellness. You were obviously on a collegiate tennis team, so there was clearly a level of fitness there. So tell us at that time, prior to medical school, obviously you were kind of maybe on a slippery slope, but it sounds like you were maintaining at least your health and wellness at that point. So tell us what Britt Morris looked like in his senior year of college.
From a physical fitness perspective, I was in pretty good shape. We trained essentially year-round for the tennis program. I did abuse alcohol, but I didn't abuse alcohol on a daily basis. It was more of a weekend thing. So I was a young man with no other physical limitations or other health issues at that point in my life. At that point, I ate a diet that was probably highly processed, if memory serves. To reference a quote that Drew had stated in a previous podcast, I was out exercising a bad diet at that point in my life. For the most part, I don't think we can get away with that. But I think when I was 18, 19, 20 years old, when you're young, you sometimes can get away with that for short periods of time. But it's certainly a poor long-term lifestyle plan when it comes to health and wellness.
Youth let you get away with a lot.
Absolutely.
Yeah.
Absolutely. I felt very fortunate to have obtained entrance into medical school. My parents, of course, were very proud. Family, friends were very supportive of that. At that point in my life, I was concerned, do I have a problem with substance abuse? At that point in time, I don't know if I did. I was aware enough at the age of 22, 23 to be concerned about it. And I was grateful for the fact that the medical school I was attending was going to be several hours away from the college I had attended. So it was going to separate me from people, places, and things that may trigger continued abuse of substances. I knew for me to survive medical school that I would have to be all in with no distractions. And that's exactly what I set about doing. When medical school started, I remember meeting Drew and a group of friends that we all became very close. But I remember feeling that I was kind of like I did back when I was in high school. I was a little bit like a fish out of water. I wasn't really comfortable in my own skin. And what I wasn't comfortable with was my ability to survive medical school. I didn't know if I was out of my depth, out of my league, so to speak. I knew it was going to take everything to try and survive this process. I questioned whether I deserved to be there, but nonetheless, we persevered and moved forward. One of the things I learned early on was that I needed to take all distractions out of my life. And so my first couple of years of medical school, I didn't even have a TV because all I did was study. I learned at that point, lived somewhat of a balanced life. In college, I was involved with a fraternity. I was on the tennis team. I was involved with student government. I had an active social calendar. So I lived what most people would call a very balanced life. When medical school came along, I lived a very unbalanced life. It was medical school and nothing else. The first couple of years of medical school, that served me well. I eventually adjusted to the rigors of a medical school curriculum and ended up having success in the classroom through the first couple of years of medical school.
For those of you that haven't gone to medical school, after 4 or 5 years of college, both Britt and I, we crammed 4 years into 5 and then went to medical school. Then it's 4 years of medical school. So the first 2 years are all booked, extremely intensive. And then the last 2 years are clinical, where you're rotating with physicians, you're rotating in hospitals. And so it's very different. The academics of the first 2 years are quite grueling. The second 2 years aren't as academic in that you're not studying biochemistry and embryology and a lot of theory, but you're actually putting it into practice, of course, being supervised by residents and physicians. Your time constraints, your third and fourth year, are about the same, but they're just different. So that being said, Britt, at the end of your second year, you've ground through these 2 years of difficult academic rigor and kind of struggled with the alcohol, or at least were cognizant of the fact that it could be a problem if it was or wasn't, I don't know. But then tell us, what was your general fitness level at that point? It seemed like we did a fair amount of like mountain biking and things like that. I know neither one of us were what we are today, but tell me about where you stood at that point.
When I arrived in medical school, I felt it was necessary for me to be completely focused on learning to be a doctor, especially those, like you said, those first 2 years. So I became very, for the most part, sedentary. I did not exercise routinely because studying always seemed like a better option or a more necessary option. One of my outlets, I became somewhat of a stress eater. I continued to eat the way I'd eaten in college, but I didn't have the rigors of a training program to offset those. And so after those first couple of years of medical school, I'd put on a little bit of weight. If memory serves, about 25 to 30 pounds. Although some of us did golf some, and Drew and I did ride mountain bikes occasionally, it was far from a routine or a rigorous training program.
So, Britt, you said at the end of your second year of medical school, you had made lifestyle changes during medical school, focusing on medical school, and you were a stress eater. You had just sort of altered your diet in maybe a negative way, what we would say is a negative way at this point, and you didn't have a physical fitness program, and so you'd put on about 25 pounds. I think that's important to highlight because that is so typical of society. What happens is we get into a rut. We start a new job and we want to climb the ladder, or we have a young family, we have a baby, we start raising kids and we put on weight. And at some point we look up and we're 25 pounds overweight. But one of the things that I think is so important to recognize is that, let's say you're 500 pounds, so you're maybe built to be 180, so you're 320 pounds overweight. Every person that's 300 pounds overweight at one point was 25 pounds overweight. Just recognizing in your life that there's just different milestones. And I think some people just get overwhelmed by that. And if it's 25 pounds, you may think it's not that hard to back off. And so you keep going. But then at some point it's 100 pounds and then it's too hard to back off. So you don't back off. I just wanted to highlight what he said there, that, he rolled into a phase of his life. Health wasn't a priority. And I just think it's so important. One of the great things about this podcast is just the ability to say that health and wellness has to be intentional. We have to wake up daily with the intention to keep our health on track.
Yeah, after that second year of medical school, I was a young married medical student. Like I said, I'd put on about 25 pounds. I was unhappy with that. Started to try to make some dietary changes to try to lose some weight. But it was during that summer between my second and third year that I was introduced to methamphetamine. Of course, that made weight loss a breeze. In fact, it was effortless. What that did is negated any potential real lifestyle changes that I might make that would result in long-term health, long-term viability, and long-term wellness. By the end of my second year of medical school, I was a little fluffy, a little overweight. But one of the things that I commended myself on was the alcohol or any type of substance abuse had not been a real issue. There just wasn't time for it. I'm not going to say that I didn't have a drink a few times in those first 2 years, but it was far from a routine occurrence, and it eased my mind in regard to my potential for having a substance abuse problem. I think that's very common. It's a common trap alcoholics can fall into, is that they'll go a period of time without using, or without using significantly, or without using consistently. And then they justify that as a reason why they can use later on. And I was soon to fall into that trap because, as Drew alluded to, in our third and fourth year of medical school, it's far less rigorous. In fact, when we were in school, the classes, they kept grades only by pass and fail. The rotations, we were either pass the rotation or fail the rotation. We didn't really have any direct patient care responsibility because we were just medical students. So it was kind of on-the-job observation, on-the-job learning. But nonetheless, it was far less rigorous than gross anatomy or neuroanatomy or biochemistry. So it was stately pace compared to what we had just experienced the first 2 years of medical school. But the trap I fell into was the summers in between medical school years. In those years, we didn't have any summer sessions, and so there was no classes, so there was no student loan money, which is what I was living on. By that point, I was married, and I needed a job in the summer between first and second year and between second and third year to make ends meet. So I took a job working with some friends out on a ranch outside of the city where I went to medical school. This was in the early 90s, and so it was during these summers that I was introduced to a drug called crystal methamphetamine. I began using that drug. I didn't use it every day, but did use it consistently, typically on the weekends. Tried not to let it interfere with my medical school training, but nonetheless, it became a part of my life. It was at this point in my life where I really started to keep a lot of secrets. My wife had no idea this was going on, but I did abuse this drug off and on for the next couple of years. Really, no major consequences resulted of that at that point in my life. My friends didn't know it. My friend Drew didn't know it. I kept it well hidden, kept it guarded. It got to the point where I couldn't imagine a social event without it. It was something that I used consistently, although not on a daily basis, but certainly I used it on a weekly basis for the next couple of years. As I proceeded through medical school, I graduated as expected and moved toward postgraduate training. This led me to another part of the country, so my access to this drug dissipated, which was a blessing. And at this point, I was moving into my training program after medical school. I was going to be trained as a general surgeon and then later a vascular surgeon. Continuing to use an illicit substance like that was not a real option. And so I was grateful once again to be separated from person, places, and things that might cause me to get off track. But again, I used that time to justify the fact that I didn't have a problem with it. Once my third and fourth year of medical school were complete, and I moved off to start my general surgery residency and left at that point in time that drug in the past, I still was without any significant behavioral changes that would result in health and wellness in a stressful environment, in an environment that I was going to be working a lot, just like I had in medical school. It was going to be more difficult, more demanding, but because I had short-circuited the process of health and wellness by using an illicit drug, I didn't really have any tools to manage my health and wellness over the next several years. And that turned out to be another 7 years of general surgery and vascular surgery training where my time was not my own. I was on call extensively. I worked long hours. Again, my health and wellness was not a priority. Nowadays, they have a 80-hour work week for physicians in training, but this preceded that by several years. So we were routinely working much longer hours. And again, it led to a very, what I'll call an unbalanced life. Again, during these years, there was very little drinking, very little drugging, because there just wasn't time for it. It was all work, very little play. Very different than what I see surgeons and young physicians coming out currently. And I guess we always think the system that we trained under is the best way to do it. And at the time, when changes were going to be made to limiting the work week of a physician resident or a physician in training, I thought that was going to be disastrous because I thought the system I was embedded in was going to be better. But the reality is I see a much different picture now. I see physicians training and being trained and working hard, but living also a full, rich life that's well-rounded and balanced with family, children, a much more cohesive type of existence that's sustainable over the long haul. Once I got out of training, all I knew was work, work, work. I had no direction as to how to carry out my life other than work all the time. And that's a very unhealthy and unsustainable way to live.
You bring up a good point there. I think we tend to, maybe as the older generation, like you said, we tend to think that our way of doing it's better. And I'm guilty of it myself. I think, well, gosh, these young residents, fellows, medical school, like they're not working as hard as we did. We tend to think, well, it's just generational. Our generation was better. And of course, the generation before us worked even longer hours. I think they do miss some of the struggle of the long hours. And I think there's something that we gained from that. But one thing that the next generation has the edge on us is work-life balance. And that is so important in so many aspects, right? I mean, if you're not working those long hours, you're sleeping better, you're likely eating better, you have the social interaction. And just like on previous podcasts, we talk about the role of sleep in weight management. We talk about the social skills and all the socialization and what that does to our brains in terms of our general health and well-being. You shine a good light on what was a problem at the time that I don't think we necessarily recognized at the time was a problem, but the powers that be did and have made changes. And, like anything, they may have swung it a little too far. And, maybe the answer's somewhere between the two, but that's an excellent point that you brought up.
Yeah, I felt like during my residency, I had some great influences on me, some great trainers that trained me well in the surgical arts, in particularly in vascular surgery. Deeply indebted to those men and women who took the time to train me. But they were a victim of a similar circumstance that I was in. They seemingly had very little balance in their life. Most of them had been married multiple times, and their life revolved around work. And thus, I became a very good mimic. I could pattern myself after them. And so thus, my life as a resident and a fellow revolved around work. My poor wife basically had an absentee husband for all of these years. And the problem is that when you don't know any different, when you get out of training, and then your time becomes your own, your default behavior is that of work all the time. And you don't know how to relax or to not work or to take that time that's important with people that are in your life and that have been supportive of your life up to that point. Certainly not blaming any of the people that were influential on my life, but it is a behavior that I learned by patterning myself after their behaviors. missing out on things throughout these years. It became very much a habit for me to miss out on important family obligations, weddings, sometimes funerals, sometimes celebrations. Unfortunately for me, it became a future predictor of how I would behave later. So we often think that when we're engaging in behavior of working all the time, that we're going to do this up to a point and then we're going to stop. When you don't have any other default behaviors to fall back on, it's hard to stop. And it's hard to know any different when all you've known for a number of years is to dedicate yourself to the work and sacrifice everything else in your life. You just become accustomed to missing out on those things. Although it may be accepted by members of your family, it's certainly not acceptable. And it's certainly not a way that you want to carry out your life indefinitely. So once I finished my training in vascular surgery, it was time to go to work. In 2002, I took my first job. Once again, I found myself in a difficult situation with health and wellness. Over the last 7 years, I had let myself go, so to speak. I'd spent my time working, not exercising, not following an appropriate diet. I was again back to eating a diet that was high in sugar, high in processed foods. By this point, though, I was in my early 30s, so I was not 18 any longer, but I was still eating like I was 18. But it was at this point that my body started to betray me, or I started to see some consequences of the way I was taking care of myself, or I should say, the way I wasn't taking care of myself. So by the time I started my first job, I had put on weight once again. This time I was about 30, 35 pounds overweight, and I just wasn't taking good care of my health. But I made that a priority, that I wanted to take better care of myself. Now that my time was my own, I wanted to find the time or create the time to exercise and hopefully eat right. I was always of the opinion that to take care of yourself physically, you had to exercise and eat right. I really thought if you broke that down into percentages, that it was about 80% exercise or hard work, and then about 20% what you eat. But again, I was under the false illusion by this point that I could out-exercise a bad diet. So I was willing to put in the work exercising. And it was of some benefit, but I really had these percentages wrong. Because what I've since learned over the last 20 years is that diet and exercise are important, but it's diet that makes up about 80% of how you feel, of your health, and the exercise is a much smaller percentage. I would estimate somewhere around 20%. Although it's important, what you put on your fork is far more important. As I moved into this new phase of my life, drugs and alcohol were essentially non-existent. I became enamored with taking good care of myself. I was trying to build a vascular practice. I started exercising. My wife and I started running marathons. We ran several together. We started doing triathlons, riding bikes. I was up early in the morning at the gym, exercising, lifting weights, and then left the gym and went to the hospital to begin my day. Over the next first year and a half, 2 years of my practice, I did lose weight. I got myself more physically fit, but I never really changed my diet. That was a mistake. Again, I was of that thought process that I could just out-exercise eating poorly.
So what did your diet look like? Just a typical American diet?
It was a typical American diet. I mean, at that point in my life, I took my meals at the hospital. Mm-hmm. So there was a lot of carbohydrate-laden meals, a lot of processed foods, a lot of foods that were high in sugar. And I didn't realize the detrimental effect that was having on me. It was negating, or at least offsetting, any gains I made at the gym or during my endeavors in exercise, which I was doing routinely, but I wasn't fueling my body appropriately. It was during these years, at or around 2004, that I started to have some physical symptoms that I really didn't recognize where they were coming from. In 2004, I started to notice that my toes and the bottom of both feet seemed a little bit numb. I didn't know what that meant, and I didn't know where that was coming from. Like a good physician, I promptly ignored it and didn't do anything about it right away. It wasn't particularly painful at that time, but it was something that I noticed. I really thought that being a bigger guy, that my running and exercising may have just traumatized my feet and toes, and the numbness was a result of that. As time progressed, it became obvious that it was a more significant concern. I began to fixate on the possibility that this was neuropathy, but I really couldn't come up with a reason why I would have neuropathy at or around 35 years of age. When a problem like this arises and the neuropathy diagnosis is entertained, diabetes is the first thing people tend to think of. And so I had several episodes where I had my blood sugar checked, and it was always normal. At the time, I just really didn't have a clue as to what was causing this. In hindsight, I'll say that there was a constellation of symptoms that was occurring at or around this time. They didn't all start at the same time, but I didn't recognize them as being symptoms, and I didn't recognize them as being potentially interrelated. And I wouldn't recognize that for another 20 plus years later. But over the course of about a 2 to 3 year period that surrounded the time of developing neuropathy in my feet, my wife reported that I was snoring excessively and had developed what could only be described as sleep apnea, where I would stop breathing during sleep. I began developing some poor sleep patterns where I couldn't sleep at night. I developed severe hypertension. Later, I would develop some brain fog issues. I also developed gumline recession. What I didn't know at the time, and I didn't learn until the last year or so, was that these are all symptoms on a spectrum of a disease process called insulin resistance, which is related to diabetes, sometimes described as prediabetes, but oftentimes occurs before we see abnormalities in blood sugar. But at the time, I didn't know this. I didn't even recognize that these series of symptoms were related. And it wasn't until years later, on reflecting back on this time in my life, that I could see how these symptoms all came about within about a 2 or 3 year period, which is pretty unusual for somebody in their early to mid 30s. It was during this time that my wife and I decided to start our family. We had our first child. It was shortly after this that we decided to make a change in practice location. I had become somewhat dissatisfied with my current professional situation, and we decided to move to get a little bit closer to home so our new child could know his grandparents better.
So at that point, Britt, you were a practicing physician, relatively new practice, marriage, exercising, primarily just not eating right at that point. That was sort of the main thing. Drugs and alcohol weren't a part of the equation at this point.
Drugs and alcohol were not a significant part of the equation. As I came into my own practice and started to build my own practice, my time became my own. I still didn't really know any other way except to work all the time, but I oftentimes had weekends available, and it was during these weekends that alcohol started to creep back in. Not a lot of drug use, but certainly alcohol use started to creep back in. But again, it wasn't something that seemed to interfere with our family life. It certainly didn't interfere with the practice of medicine at that point in time. My wife and I spent most of our leisure time training or running, exercising, lifting weights. That was a big focus of our spare time during the week, and it was certainly a big focus of our time on the weekend. So alcohol was a part of the equation, but it was a relatively small part of the equation at that point in my life.
So I know we talked a little bit about the potential role of exercise being an obsession or an addiction. We talked about that prior to recording. I know you've said that you think maybe you have an addictive personality. So at the time when you had your first practice and you were in that role of exercise, was that encroaching on an obsession or an addiction that ultimately ended up being taken from you from health and then you substituted it? I'm just laying the groundwork because I don't know the end of the story, but I kind of know where it goes. So I just want to sort of pull people along a little bit, if you can speak to that.
Absolutely. I think you're right, Drew. I think once I found a path or a niche outside of medicine, all I had known for the last 11 years of my life was heavily involved in the learning of medicine, the training of becoming a surgeon. So all I had known was that. And then in building a new practice, I developed this affinity for exercise, and it became, as you put it, somewhat of an obsession. So it became something that myself, my wife, and a group of friends, we spent a lot of time doing, going to races on the weekend, training on the weekends, Early morning hours at the swimming pool or early morning hours at the gym were a part of my daily routine. Over the next several years, as the neuropathy in my feet became more of an issue, it made those physical activities certainly less enjoyable and really essentially took those away. And so it did at that point leave a void in my life. It left a deficit that I struggled to fill. I developed some anger issues regarding that. I was resentful of the fact that others could do those things and then I no longer could. During that process, as I became somewhat resentful of the fact that I couldn't do the things that I once could, I started to resort back to more and more into the abuse of alcohol. I became somewhat dissatisfied, probably unjustly, with my current practice situation. Began to think that I wasn't being treated fairly, which was not true. I began to think that I could do better elsewhere, whether that be from a professional standpoint or from a financial standpoint. At this point in my life, shortly after our first child was born, that we decided to make a move. And I justified that by saying that we were moving back to get closer to family, which was true. But the truth of the matter is that I had really no great reason for leaving the practice I was in. I'd become angry, dissatisfied because one of my passions or my obsessions was being taken away from me. And that was the exercising that I had grown accustomed to over the last couple of years.
Big problems always start as small problems. Sometimes we just don't always have the insight at the time. When we look back, oftentimes we can see sort of the inciting event or the triggering event that led us down these paths. We all have taken the wrong road multiple times. And, most of us are fortunate enough to have got off of the wrong road and back on. But it's just interesting that these little things, and whether it's losing the ability to exercise or falling off of our diets if we're on a diet or whatever it is, whatever our issues is and our compensatory mechanisms, little problems turn into big problems so often. And so it's just insightful to see it.
Yeah, I think true. In hindsight, looking back on that time, I had developed this neuropathy that nobody really could explain. At that point, to be fair to everybody that was involved, I didn't really seek a lot of outside input as to what the source of those symptoms may be. I wanted it to go away so I could continue to live life the way I wanted to live life. And when it didn't go away, I, was somewhat resentful of that process. What I truly wanted was to know why this was a problem and know how to remedy it. But what I wasn't willing to do, Drew, was that I wasn't willing to roll up my sleeves and do the work to figure it out. I mean, for crying out loud, I was a board certified vascular surgeon at the time. I had the mental ability and the wherewithal to figure this out. But instead, I chose to do essentially nothing for a number of years while this process just continued to get worse. It was during these years, I became somewhat embittered, resentful, and it was that lack of, let's say, personal effort on my part to research and to try to repair what was wrong with me. I guess a good term for that would be I'd become somewhat lazy or academically lazy. If it was a patient with this problem, I would have rolled up my sleeves and figured it out. But it was me, and so I just expected it to go away. I think I felt entitled to the fact that I had worked all these years. I'd gone to medical school, I'd made good grades. I'd had all this post-medical school training for the last 7 years. And I think I thought my life was supposed to be perfect after that. When it wasn't, I became resentful of the fact and became embittered to that situation. That led me to make some really bad decisions. When you start living in the world of self-pity, it's a very selfish, self-centered way to live. And it was taking me down a path that I didn't want to go. But nonetheless, time rolled on. My family and I moved to a new practice in 2005. I, of course, took the neuropathy with me. I took the sleep apnea with me. I took gum recession, the hypertension, and the poor sleep patterns. I took all of that with me unremedied, and it was doing nothing but getting worse. By 2006, 2007, I developed some ulcers on my feet. They quickly became the bane of my existence. They were non-healing, they were chronic, and I couldn't get them to go away. Once again, although I started to seek medical care, I wasn't willing to do a whole lot for myself. I wanted a quick fix. I wanted a pill to make it go away or a procedure to make it go away. And there just wasn't one. The simple thing in hindsight that would have helped and given me a chance at correcting this problem was some healthy lifestyle choices. And I just, at this point, was willing to seek a medical opinion, but I wasn't willing to really dig into the problem and figure it out for myself. As time rolled on, life continues to happen. In 2006, my younger brother died of a drug overdose, and that was a jarring effect in my life.
At that point in time, were you involved in alcohol or drug use, or were you still kind of evolving toward that?
I was evolving toward that. That's a polite way to put it. I was evolving toward that. Yes. I've been evolving toward that since I was about 18 years old. So, but I was not using drugs. I was drinking some, but it was far from a problem at that point in time. In the recovery programs, we talk about an imaginary line that we sometimes will cross. Many times we won't know that we crossed it when our drinking becomes an obsession and we start drinking just to change the way we think or to change the way we feel. Most of us, a lot of us in the recovery program, we don't know when we cross that line. We just know that we can't put the alcohol or the drugs away like we could once before. And that happened for me the day after my brother died. I started drinking and drugging for a very different reason. I drank and drugged to change the way I felt about life, to change the way I felt about the day I was having, to change the way I felt about the people in my life. And I started doing it more and more frequently. And it really started to become a problem.
Two things on that, Britt. So you start to drink to change all of those things you just said. And then when you were in college, you drank to change the way people perceived you. When you were younger, it was a manifestation of how you were seen and perceived. And later in life, it was your perception of yourself. Is that a fair assessment?
It's a very fair assessment.
So tell me this, and I think a lot of people would have this question for you, and it's a tough question. You and I are in a very unfortunate club in that we've both done CPR and life-saving measures on family members, you with your brother, me with my son. How do you go from doing CPR on your brother who doesn't survive from a drug overdose to the next day participating in the same activity that took your brother's life? Can you help us to understand that, or is there an understanding of that?
I don't know if there's an understanding of it. From my perspective, part of the problem was I'd flirted with that lifestyle for much of my adult life up until that point. Most of the time, it had been to have a good time. It had been, in many ways, positive events, celebrations or parties or nights out with friends. But it was at this point, I had participated with these activities with my younger brother many times. And so being his older brother and watching his struggles and then watching his death, it led me to an immense amount of immediate guilt and shame. I felt the responsibility there. He had 2 small children, and his wife was several months pregnant with their 3rd child. So it was a tragic event all the way around, and it overwhelmed me. You're correct. I knew that this was the same behavior that killed him. In these lifestyle choices, we make decisions that defy logic. They defy reason. And then sometimes you just think the rules don't apply to you. And sometimes you just don't care. I was at that point where I just didn't care. I felt such immense guilt and shame the night after he died that I just wanted to escape it. And of course, you tell yourself, we're just going to do this for tonight, or we're just going to do this for a little while. 20 years slips by pretty quick.
Mm-hmm.
But that was when my relationship with drugs and alcohol really started to change. I was still dealing with a lot of issues with my health. I was dealing with this painful neuropathy with wounds that weren't healing. I had sought some local medical care and medical opinions from internal medicine specialists, neurologists. I was referred to the Mayo Clinic in Rochester, Minnesota. In 2009, I made that journey there with my family in hopes of finding a reason for this. Now, at this time, I was, fighting a war on 2 fronts. I had these health issues. I was trying to manage a medical practice, but I was struggling significantly with drug and alcohol addiction. I was hopeful for some insight. By this point, I had had several of my toes amputated on both feet. I can recall journeying there in 2009. I had active wounds on both feet at that time as well. Unfortunately, there was no hard, fast answers provided during that trip. Part of it was a good trip simply because we learned of a lot of conditions that I didn't have. What we didn't learn is what was the true source of this advanced neuropathy. There was some concern that I may have a mild case of type 2 diabetes at that point, which is sometimes related to neuropathy. But the physicians that took care of me, and I saw specialists in neurology, saw retinal specialists, I saw kidney specialists, I saw an endocrine specialist. All of these were world-renowned healthcare providers, and none of them felt that the relatively mild case of diabetes had anything to do with my neuropathy. They almost viewed it as a coincidental finding. On the journey home, I remember my wife was driving. We had my son with us, and my daughter was with us as well. And I was making some notes as to what I could do when I got home. At that point, I was willing to be a little bit more proactive in my health and wellness than I had been up to that point. So when I got home, I again rededicated myself to exercise. And this time, I started to follow a little bit more of a reasonable diet that would be conducive to managing type 2 diabetes. I was given the drug metformin, which I took faithfully. I routinely checked my blood sugar and quickly got that under control to the point where the metformin, after several months of taking it, it was recommended by my physicians at the Mayo Clinic as well as my local internal medicine physician that I could stop taking it. Over the next couple of 3 years, I continued to exercise. I continued to take good care of myself from a physical fitness standpoint. I continued to eat not an ideal diet, but a much more restrained diet that I had eaten up to that point. I had a period of stability with my feet where my wounds healed, and I required no further surgeries for the next couple of years.
And were you drinking or using drugs at this time?
At this point, there was still some drinking. Drew, I still had neuropathic symptoms in my feet. Although my wounds had healed for a couple of years, I still had this electrical sensation in my feet, the numbness, tingling, and it kept me up at night. Over these years, there was some drinking and some drug use, but it was prescription drug use at this point. Opiates, pain pills.
More to help you sleep because of the pain in your feet?
Yeah, they would put me to sleep at night and I could get a good night's rest. On nights where I didn't take that or I didn't use alcohol, I was typically up throughout the night. It was a nightmare of a situation to try to manage because I would end up going days without sleep. It became a real challenge to maintain my daily schedule because of my difficulty with sleep, difficulty with pain, and trying to manage those as well as manage an active medical practice was becoming an overwhelming process. By 2012, unfortunately, wounds became an issue again. Spend a lot of time as a surgeon on my feet, so it puts a lot of pressure on your feet. And when you have neuropathic feet, it's very easy to develop ulcerations. My circulation was intact and was normal, but once a wound developed, they continued to make treating that wound difficult, a very painful, slow healing process.
So, Britt, just for the benefit of everybody, when you have a neuropathy in your feet, then you have a numbness and maybe a lack of sensation or sometimes hypersensation. But when you have a lack of sensation of what's going on in your feet and then you do something to injure your foot, that's what initiates these ulcerations that you're describing. So some people who have ulcers of their feet have a vascular problem, but you didn't have that, right? You couldn't necessarily feel when you hurt your foot, when you did something to your foot, and that wound would then just continue to grow, maybe unknown. Is that a fair assessment?
That's correct. When you have a dense, aggressive neuropathy like I had or have, your foot lacks some compensatory or protective mechanisms that a normal foot would have. So when the bottom of my foot would rub on the sole of my shoe, your foot has a natural compensatory mechanism to offload that area without you really voluntarily telling it to do so. It just does that. With neuropathy, you lose that compensatory mechanism. And so when I'm standing for several hours doing surgery and let's say a bony prominence on my foot is rubbing against the side of my shoe, my foot doesn't recognize that. And at that point in time, I don't feel that. But by the end of the day, when I take the shoe off,
The tissue's ulcerated.
there's a hole in my foot. Yeah.
Okay.
That became a real challenge. Once those ulcers came back, I would say that really was around 2012. It was really a defeating process for me. Probably became somewhat depressed. I was tired of being in pain. I was tired of having these wounds being a persistent, recurring problem. And I really, again, fell back into that process of feeling sorry for myself, or what we call like the victim modality, where I just, instead of trying to deal with this, I just kind of wanted to feel like I just didn't deserve it. For lack of a better term, I wanted to pout about it. And this in turn led to an escalation in continued substance abuse issues, to self-medicate. I felt like I deserved it because I had all these issues. That was my justification for it. It wasn't right. I can see that now clearly, but that's how I dealt with that issue. By 2013, they had become a problem to the point where I elected to have transmetatarsal amputations. I had both feet amputated at the same time, about half the foot on the left and on the right.
How did you walk after that?
Well, interestingly, it took several months for that surgery to heal, so I couldn't walk for a while. But when you have neuropathy for as long as I'd had it at that point, one thing is your balance is not great. But one of the things that your body does, it does compensate for that. Your mind compensates for that. So I wasn't going to win any foot races. I wasn't going to start running, but walking, it was not a major problem. I wore special inserts or orthotics that I had built that would fill in this dead space at the end of a shoe where my toes would have normally been.
Mm-hmm.
My balance wasn't the greatest, but I was able to walk, ambulate, and eventually I was able to go back to work.
Yeah.
As you can probably tell, during this time, I had finally come to the realization that I have a problem with drugs and alcohol. To have this surgery done, I was going to have to take significant time off work because I had to be non-weight bearing for the next 90 days or so. Had the surgery, got through the immediate postoperative pain, which occurred over the course of several days, maybe a week. And then I quit using drugs and alcohol.
You just quit on your own. You just decided that wasn't it, and boom.
I quit on my own. I quit for 36 days. And I realized at about 36 days that I was going to need some type of help or support in maintaining this. I had some friends in the recovery community. And so I reached out to one of those who also worked in healthcare, and he took me to my first recovery meeting.
These people that you knew, did they know that you were struggling, or was this still kind of on the down low?
It was on the down low until I told them.
Yeah. So nobody knew.
Nobody really knew. My wife knew.
And when you say drugs, was it crystal meth still, or?
No, I mean, I hadn't used methamphetamines in a number of years. This was mainly alcohol and opiates.
Okay.
I started going to AA meetings, started working an AA program. I got a sponsor. And by the time I went back to work, I had in excess of 80 days of sobriety. I was very pleased with that. You know, like they say, my life started to get better. At that point, my incisions on both my feet were well healed. I had no more wounds. I still dealt with some painful neuropathic issues, but I was able to manage those at this point without drugs or alcohol. Like I said, as I continued to work this program, I went to a lot of meetings. It became a big part of my life, kind of like exercise had in an earlier season of my life. It became somewhat of a little bit of an obsession. I went to a lot of meetings, sometimes as many as 2 a day. I started trying to exercise on some level again. Of course, I couldn't run or bicycle like I had done previously because of my feet. Nonetheless, I was making sincere effort to take better care of myself and follow a program of sobriety. The recovery program is a program that you can't just be partially in. You've got to be all in. You've got to practice a program that's 100% committed, that's rigorously honest, that of course you're 100% abstinent, but there's also other pieces to the program that you've got to practice. And one of those pieces is the 12 steps and working through those steps. And that's where I started to hit a snag. I was sober. I was going to a lot of meetings, but I wasn't being rigorously honest. I wasn't working the 12 steps. I had a sponsor. he was trying to get me to work the 12 steps. I wasn't willing to do the heavy lifting or do the work at that point because my life had gotten some better in sobriety. That's a great predictor of an upcoming relapse by not taking that advice and taking those opportunities to work through the 12 steps. Over the course of that first year, I had a year of very good sobriety. My life got better. My marriage got better. My medical practice got better. I was happy and I was pleased with my progress. But I thought the program of recovery, I treated it like a cafeteria, that I could pick and choose the pieces of it I wanted to follow. And then the more difficult things that I didn't either think I needed or that I didn't want to follow, I could leave them. And that's just not true. As time went on, I started to notice other behaviors started to creep in and replace drugs and alcohol. I didn't recognize this at the time for what it was, but you don't deal with these character defects that are typically dealt with during the working of the 12 steps, then they'll creep back into other areas of your life. And that's exactly what happened to me. I was sober. I was not drinking. I was not drugging, but I began to compulsively gamble. I began to compulsively view pornography. I began to have an affair and cheat on my wife. All of these things were manifestations or symptoms of the character defects that I wasn't dealing with completely by taking my sponsor's advice and working steps. I was still going to meetings, although they became less and less over the subsequent year. And my life began to spiral once again, not from drugs and alcohol, but from a lack of transparency in my life, a lack of honesty in my life. Over the course of the next 2.5 years, I destroyed my marriage, alienated my relationship with my kids. My personal life became a catastrophe. My wife and I separated, and we ultimately divorced several years later. I alienated my parents. Anybody that truly cared for me, I pushed away. At this point, I wasn't drinking or drugging, but I was not practicing the principles of this program that required long-term success, long-term happiness, and long-term healing. As time went on, I became more miserable. After about 30 months of sobriety, about 2.5 years, I came to the illogical conclusion that the reason my life was spiraling out of control wasn't because of something I did or didn't do. I convinced myself that it was because I wasn't drinking anymore. I convinced myself that my life was fine when I was drinking, drugging, and then the reason my life was now spiraling wasn't because I hadn't taken the suggestions in the program of Alcoholics Anonymous. It wasn't because I hadn't worked the steps of Alcoholics Anonymous. It was because I wasn't drinking. And that was just cover for me, a reason to start drinking again, which is exactly what I did after 30 months of sobriety. They teach us in the program that during periods of abstinence or sobriety, your disease is kind of waiting outside the door for you doing push-ups. It's going to be worse than it was before. It always gets worse, never better. I learned that the hard way. Started drinking again in the early part of 2016. And within 1 month, I was checked into a lockdown psychiatric unit in Houston, Texas, to try to get me to clean up, sober up. That's how quickly my disease descended upon me.
So that was within 1 month of starting drinking again.
That's right.
So how did that go down?
Once I started drinking again, my behaviors at work became unacceptable. I became erratic. This is just within a few weeks of that first drink. The state medical board was called in. Of course, I denied everything. I still wasn't ready to get honest. I denied any type of substance abuse issues. And they did some testing and in the end found that there was nothing in my system that would have explained my behaviors.
Was that just pure luck?
Pure luck. Pure luck.
Yeah.
Probably would have been better for me if they had found something.
Sure.
Yeah. At that point, I couldn't sleep at night still. I'd started to struggle again with severe pain in my feet. I had new ulcerations that had developed.
And you hadn't had any when you were sober?
I hadn't, no. This came on pretty quick.
Yeah.
I'm not saying the alcohol caused them, but it certainly didn't help.
Yeah.
Once the state medical board came in, they had suggested that I get some mental health help. There was clearly something wrong with me. Of course, the problem was alcoholism. I wasn't admitting that. In fact, I was denying that. And the testing supported what I said. So the state medical board thought, let's get a mental health evaluation, which is what led me down to the psychiatric unit in Houston.
So lockdown, though, I mean, you did do so good on that test, I'm thinking.
Well, I didn't test positive for anything, but it was my behavior that was erratic, unpredictable. I was routinely late for everything. I would sometimes just not show up. During the process, as my marriage came apart, I had been seeing a psychiatrist. He thought I needed some type of inpatient evaluation as well. So it was a combination of things that coincided shortly after my resumption of drinking that led me to this psychiatric unit stay.
Yeah.
This stay had some purposes. It wasn't just like they threw me in and said, when you're better, you can get out. Before going down there, I'd had some further issues with my feet. So I had to have a minor surgery to clean up some ulcers on the bottom of both of my feet. I agreed to go to this psychiatric unit. Unbeknownst to me, upon agreeing to go, I didn't know it was a lockdown unit until I got there and they locked the door.
How'd that go over?
Well, I tried to leave, but they had locked the door and they wouldn't let me out.
And then are you withdrawing at this point?
At that point, no, because this is how I manipulated that system. What happened is that this unit, they weren't going to take a list of meds from me. They were going to only take a list of meds that came from my provider or from the hospital. And so just before going down there, like I said, I had a relatively minor surgery on both of my feet where they did some debriding of some ulcerations. During that process, they gave me some oxycodone for pain control in the immediate post-op setting. That was for like the first 24 hours where they dosed me around the clock with it for 12 to 24 hours. I can't remember exactly. But that is the med list that got shuttled to the psychiatric unit. And so how they perceived that order was that I could have
Around the clock
Oxycontin around the clock.
Yeah.
And I knew what that order's intention was. It was for the first 24 hours. And maybe I could have very limited amount on an as-needed basis over the next day or two, but it wasn't intended to give me long-term access to that drug while in a psychiatric unit.
Yeah.
I didn't bother to make that distinction for them. I saw the situation for what it was and took full advantage. So they gave me 20 milligrams of oxycodone every 4 hours around the clock. And they did that for the next 17 days. When I got there, there was a full medical evaluation that went along with a psychiatric evaluation. And the medical evaluation discovered at that point that I was at least an insulin requiring type 2 diabetic, which up to that point, nobody knew about.
There was no diagnosis of diabetes or insulin resistance or anything.
Nothing. I'd never even heard the term insulin resistance at that point.
Right.
So I didn't know anything about it. But they put me on insulin right away. And I can remember the day I arrived and they diagnosed me and they put me on insulin. It was the first night I slept in a long time simply because I had all the hallmark symptoms of diabetes. I was up 8 to 10 times a night peeing. I took ice water to bed with me. These are hallmark symptoms of diabetes. So that was clearly part of the problem. The other part of the problem is that I was abusing drugs and alcohol. During my stay at the unit, I was scheduled to be there for about 8 weeks. They arranged for me to have an endocrinology evaluation, and they put me on a couple different forms of insulin. I saw a foot surgeon there who took care of my current wounds and my post-operative wounds. I saw a neurologist there who came to the same conclusion that the Mayo Clinic had 7 years earlier. They did not think my neuropathy and my diabetes were related. And I had no reason to doubt or, not believe that.
Well, and the standard line of thinking is that neuropathy follows longstanding diabetes.
Correct.
Not predates it.
Correct.
And to this day, that stands.
Correct.
As the general thought.
That's right. I don't even know if that I disagreed with it. I really kind of was resigned to the conclusion that I was kind of an oddball case, that for whatever reason, I developed neuropathy several years before I developed elevated blood sugars. But again, as you pointed out, at this point, I didn't know anything about the metabolic syndrome or insulin resistance. Maybe I should have known. Maybe I should have been looking all along, but I wasn't. Like I said earlier, I'd become somewhat lazy in regards to my own self-care or my own health care. And so that's where we were at that point in time. in 2016. By this point, I'm in this unit. My wife, now ex-wife, has moved to another city with my children. We are in the process of selling our home that we had built. But I'm still in this psychiatric unit. I'm still not ready to get honest. I'm still not willing to admit to the problems that I had. I wasn't willing to, even though I had been in AA previously, I wasn't willing to tell these folks what my situation was because I knew then that that would classify me as an impaired physician. I knew then that the hospital and the state medical board would immediately know the results of that. In hindsight, it was a huge mistake, but I continued to deny that process. I continued to take advantage of the quote unquote glitch in the medical records process and abuse the oxycodone that they continued to give me. And then I continued to not do the work while I was in the program. After 17 days, the psychiatrist who was taking care of me calls me in and says, you're taking 80 milligrams of oxycodone a day every 24 hours. You've been here for 2.5 weeks. I'm not sure you need all of this oxycodone. So I'm going out of town for a couple of days. When I come back, we're stopping all the oxycodone. Again, I'm manipulating the system. So at this point, technically, I had checked myself into this unit. I hadn't been forced in there or committed to be in there. I had checked myself in so I could check myself out. So the minute he left town, I started demanding to be released, in which they ultimately did. They had to let me go. The psychiatrist who was going to discharge me was not my psychiatrist. It was a fill-in psychiatrist who was covering for the day. Their policy was to give you 2 months of prescriptions of all the meds that you're taking upon release. So I was on some antidepressants and some blood pressure medicine, but I was also on this oxycodone. It hadn't fallen off my med list yet, and so they gave me a 2-month supply of this drug to go home with. Once I got out of that hospital, I drove straight to a pharmacy, filled what was a couple of hundred oxycodone, and then checked into a downtown hotel room and spent the next 5 days drunk and high. Then I rolled back into my hometown after being gone a little over 20 days. I was supposed to be gone 8 weeks, loaded up on alcohol, drugs, barricaded myself into my house. Basically, I hid in my house so nobody knew I was back in town, and proceeded to spend the next few weeks staying drunk and high. So by the time I went back to work, I was in worse shape than when I started. And people could see that at this point. People had had enough of me. It had gone on for too long. And so I held it together maybe for a short period of time. But by the time 2017 rolled around, they had had enough. And ultimately, they were going to fire me one day unless I did a drug and alcohol test, which I did. Again, these tests are not as foolproof as people think. There's no really explainable reason why it wasn't positive, but it wasn't. They didn't fire me. I worked a very short period of time. I wasn't actively using at work, certainly feeling the after effects of drug use when I came to work, or alcohol use. Hungover, not in great shape. And this finally is what got me put out of my career was, in a hospital, when you do a procedure or you see a patient encounter, you pick up a phone. They used to call them dictaphones, where you would dictate into that phone. A transcriptionist would pick up the recording at some point and type out a report. I was so sleep deprived because of my nocturnal activities. I was passed out on the phone with recording going on, and I'm rambling about drugs, alcohol.
While you're asleep?
While I'm asleep on the transcription line.
Yeah.
And of course, the transcriptionist heard it and took it to the medical board, which she should have.
Yeah.
And that was that.
Yeah.
That's what effectively ended my job at that point in December of 2017.
Yeah.
It's interesting, though, as we move through this, I talked about consequences back in college. These are consequences. My marriage coming apart, my life coming apart, my health coming apart. These are all consequences of the life that I'm leading. They stem from having a bad diet, to not taking care of myself, to extensive alcohol and drug abuse. These are consequences of that behavior. Sometimes it's hard to fire a physician. People are concerned about repercussions of that. Make no bones about it. I was responsible. The hospital had every right to release me, but they weren't so sure of that. They weren't so sure because over the years, I'd had several drug tests, alcohol tests, and they were negative. And so there was some concern, is this something else? I had diabetes. I was on insulin. there was some question of were these hypoglycemic episodes. And of course, I fed into that, was trying to escape.
That gives you cover.
Yeah, I was trying to do that once again. They didn't really know what to do with me. So they sent me home. For whatever reason, I probably will never know this reason, they continued to pay me, which was not an insignificant amount of money for roughly the next 6 months. I had no allowance in my contract for a severance package or any kind of buyout. I mean, they fired me for cause, and they had good cause, but they continued to pay me. And then after 6 months, they reached out to me and said, if you'll forgo any kind of legal action, we'll pay you a severance package on top of what we've already paid you, which was another significant amount of money. In the process of all this, my ex-wife and I had sold our marital home. We'd profited from that, and we'd split those proceeds. I say all that to say that I'm at a pivotal moment in my life. By this point, it's the back half of 2018. I have no job. I have no prospects for a job.
Do you have a license?
I still have a license. In fact, after getting fired from my job, I renewed my license a few months later. So I carried an active medical license until the middle of 2019. And then I only relinquished the medical license because I didn't want to pay to keep it up. At that point, I was so short-sighted that I saw no prospect of using it. To maintain a license with CMEs and the fees that are associated with that, and you're not doing anything in the practice of medicine,
It's an expense.
It was an expense that I didn't need. I mean, I had other things to spend my money on. In the back half of 2018, I had a pile of money. I had some cash, and I had some resources, and I had a chance right there. I still had an active license. I didn't really have any sanctions against me, so to speak, on my license. It was a great chance to recognize the consequences, to recognize the downward spiral of my life. It was an opportunity to reboot my life. I had the money to put myself into rehab, clean myself up. An impaired physician, but I would be employable again. And there's plenty of great stories out there of physicians who had done that, rebuilt their life after addiction. But I chose option B. I just doubled down on what I was doing. And what that meant was I continued to drink, continued to abuse opiates, started abusing cocaine, methamphetamines, heroin, fentanyl as well. I quickly moved from snorting and smoking these drugs to IV injections.
You're doing this in your home?
In my home, yeah.
And how did you find a dealer for this in your hometown?
Good question. I had a friend who I had done some cocaine with in the past, and I had run into him, and he had a connection in Texas. Took me down there to meet the guy. This guy, by far the best drug dealer I've ever had. And I say that in the sense that he was always available and he could get anything. And that began a multi-year relationship, traveling back and forth.
So you drop down to Texas and get it?
Mm-hmm.
Yeah.
Yeah. At first it was cocaine. Just snort the cocaine. When you're doing that much cocaine, your nose doesn't always work as well as you want it to because it's not a natural process. And so I wasn't using my diabetic needles to give myself insulin, so I started using them to give myself cocaine. There was various women, pimps, drug dealers in and out of my life for the next couple of years.
You weren't doing this alone?
Not always, no. I had 5 women overdose in my house. 2 times a woman overdosed in my house that she quit breathing. And there I am, about 180 pounds, soaking wet, with a pair of cutoff sweats on, dressings wrapped around both feet, no shirt, covered in track marks. And I'm doing CPR on this woman. And it happened twice.
Same woman?
Uh-huh. And what am I thinking the whole time? What's going to happen to me? This woman you got no pulse.
Yeah.
You're not breathing. And I know it. I'm thinking I'm going to end up in prison.
It's all about you.
It's all about me. All about me. So the first time I get her back, the situation started with a seizure, and then it progressed to lack of a pulse and lack of breathing. And so,
but she was using as well.
Oh, absolutely.
Right.
So I get her and put her in my bed. She's post-ictal, which means she just had a seizure. So she's very sleepy, somnolent, but she's neurologically intact and just kind of out of it. So she goes to sleep for a couple of hours. I go back to the drugs. This has just happened, and I'm shooting up again. 2 hours later, she wakes up. We discuss it, and then she starts shooting up again.
Wow, addiction's real.
It's real. It was real. It was real then. And then just a few months later, it happened again.
And you said same woman.
This time with the same woman. Yeah.
Was this a girlfriend? Was this?
Yeah. Ish. Yeah.
She's still alive?
As far as I know. Yeah. Yeah.
I mean, if you're going to overdose, overdosing in a physician's house, even if he is impaired, is better than the alternative.
I never considered, the selfishness of my actions is not only what I was thinking, but what I was doing. Now, I was doing CPR and doing what I had been trained at some point in the past to do, but I didn't call 911 because I was afraid of the consequences as they would reflect on me. Now, not that everybody and their dog didn't know what I was. I mean, I was a vascular surgeon who had pissed away a career doing drugs and alcohol. But I was concerned about the ramification of, is this woman going to die? But not concerned enough to make a phone call.
So did you have Narcan there?
Nope. I don't think Narcan would have helped as much. This wasn't
an opioid.
It wasn't an opiate. It happened again a few months later, very similar circumstances. And this time when it came to, I had a plan of what I was going to do in my infinite strung out wisdom. I said, we've got a half ounce. I was buying cocaine by the ounce. I mean, I was buying multiple ounces every couple of weeks.
Which, how much is that? What's an ounce? Back then, what was an ounce of coke?
An ounce of coke at that point was, about $800 to $1,000 for it.
So your pile of cash, you got to be burning through it at this point.
Oh, it would, like gasoline. I'm going through it. I'm buying multiple 8 balls, multiple ounces of cocaine. I'm a compulsive gambler and I'm not any good at it, so I'm losing. I'm not working. I'm not employable. There's nothing that I'm doing that's redeemable at this point.
At that point in time, you're doing all of these things, right? And we talked about when you're in college, you do it for the perception. Later, you're doing it for your perception. Mm-hmm. At this point, are you doing it for anything? Or are you just doing it to get that next high? Is it at this point, it's just biochemical? You have to get a dopamine release. I mean, nobody wants to be skinny, cutoffs, pockmarked, doing CPR. Like that's how people are perceiving it. So you're not looking for that. So is it at this point just primal physiologic dopamine hits that you're after?
Yeah, I mean, at that point, I probably wasn't thinking about it in terms of a dopamine hit, but yes, that's in essence what it was. I mean, I was addicted to the next high. Now, what I'm not telling you, those were things I did most days. The things I did every day was drink a half a handle of Jim Beam about every day and a half, 2 days. And I chain smoked marijuana, like 6-7 grams of marijuana a day. But I had a marijuana card, so that made it okay.
Right. It's all legal. It's all good.
Yeah. So, after that second overdose or that second CPR session, when she woke back up, we made a decision, said, well, this is it. No more cocaine. But there's about, I don't know, there was a significant amount of powder left at the house, and I couldn't bring myself to throw it away. So we did all of that later that same day. Then I pick up the phone and call my dealer and say, no more cocaine. Can you get me some methamphetamine? The crystal meth from the 90s is morphed into what they sell now called ice, which is not the same product, but a very similar product, a stimulant-based drug. Methamphetamine, it's just a different formulation. And within 24 hours, we had that, and we were off and running again. I'd go down there, buy an ounce of that. And first time I went down there, he knew I'd always carry cash. He knew I'd always bring some extra. And he'd say, well, they made a mistake. They gave me 4 ounces instead of 1 ounce. That's a lot, for somebody that's not going to sell it. I'm not selling any of it. I'm going to do it all. Or
you're going to try.
We're going to try, yeah. And so that's how things went for the next several years. That was the life I led. It was a constant dose of alcohol, marijuana, methamphetamines. Opiates were in play always. Once I started injecting the drugs, and that was probably around 2018, that's the only way I wanted to do them. I burn up all the veins in my arms, burn up the veins in my legs. It had destroyed my life, but it was destroying what was left of my health. And probably more importantly, it was destroying my mind. When you're doing drugs at this pace, not once a week, not once a month or twice a week, or not occasionally, but you're doing it all day, every day, your mind ceases to exist normally, and you start to exist in what I'll call an alternate reality. There's paranoia. You believe things that aren't true. You create scenarios in your head that aren't reality, but you believe that they represent reality. It is a soul-destroying lifestyle. And that's what it did to me. I mean, by the time 2022 rolls around. I haven't worked or done anything productive in almost 5 years. I've been hospitalized a couple of times for severe foot infections. I have virtually no relationship with my kids, and I'm toxic. I mean, the people in my life are running from me at this point. It's just me and the drugs for the most part. So my parents have very little contact with them because I knew if they saw me, they would know exactly what I'd been up to. I mean, it didn't take a neurosurgeon to figure that out once you saw me, covered in track marks all the time. I was rail thin and very, very unhealthy. I had the worst wounds on my feet that I had ever had. Of course, it didn't help. The veins in my arms I couldn't access anymore. The veins in my neck or my chest I couldn't access anymore. So I was accessing veins in my feet, which is where my problem was to begin with,
Right.
So that was not a very smart move. About halfway through the summer of 22, my mother gets diagnosed with lung cancer. It's a type of lung cancer that's aggressive. The prognosis poor. It's in her mediastinum, so it's in the central part of her chest, so it's not surgically fixable. She undergoes chemotherapy and some radiation, which didn't really help a whole lot. Maybe it helped a little. I'm in the middle of a methamphetamine alcohol binge that's been going on for months, so I'm always in the middle of that. I remember some of it, but I don't remember a lot of it because I was so strung out. I don't mean strung out because of lack of drug. I was strung out because I was heavily involved in the use of them still.
Yeah.
My drinking was out of control. I started drinking at daylight and went until I fell over. I would pray for death at night, and then I'd be mad and curse God in the morning when I was still alive. That was the condition I was in. And then immediately I'd go back to drinking, drugging, smoking, shooting up throughout the course of the day. So she passed away in November. In December, middle of December, I get sick, like fever, chills. And I've got a wound on the bottom of my right foot. There's no skin on the bottom of my right foot. It's just soft tissue, muscle, and it's been that way for probably over a year. I've been managing it, trying to keep it from getting infected. And I knew that once that got infected, there was nothing more they could do for what was left of my right foot. My left foot wasn't in great shape, but it was better than the right. The veins were still good down there in the right foot,
Good vascular.
Yeah. So they were easy to access. They were big and bulky and easy to access. And but I went to my foot surgeon who'd been taking care of me for years and still takes care of me to this day. And he said that you're going to lose this right foot. And so he puts me in the hospital. I'm pretty sick at this point.
You're in your hometown.
I'm in my hometown. Third surgeon comes in and wants to take the leg.
The leg, not the foot.
Yeah, he wanted to do what's called a below the knee amputation, which is what would be necessary. And I kind of balked at it like I have a choice, and he says, well, you can likely live without a foot, but you're going to be dead in a few days if I leave this foot on, because there was osteomyelitis, so there was infection in the bone and probably some deep space abscesses in what's left of the foot. But then all of a sudden I didn't want to die. So then I said, oh yeah, I'll take the foot, And so following day he took the foot. That was on the 18th of December, 2022. I told you earlier, I knew I wanted out of this life that I had created, but I couldn't see a path forward, and I prayed for the first time in a long time for a path forward. And if I couldn't see a path forward, I prayed that I'd just die during surgery. And I believe at that point, God did for me what I couldn't do for myself. I woke up 6 days later. I lost about 6 days in there from the surgery. I woke up on Christmas Eve is the next thing I remember. And I felt better. This dead, decaying right foot that had burdened me for a long time had been removed, and the infection within it was gone. And so I felt better. And for the first time in a long time, I could see the possibility of trying to restore my life. I was still in the hospital for another 3 weeks, for about 3 weeks total, I guess, and with antibiotics therapy. And then they moved me into what's called not a drug and alcohol rehab, which is what I probably needed, but a physical medicine rehab setting where they could show me how to live with a below knee amputation and take care of myself, which was invaluable. I had no resources. I had no insurance. The same CEO in the same hospital system that fired me 6 years earlier, were there to help me, not only to facilitate the surgery, but to facilitate my recovery, to get me into their physical medicine rehab program, to try to give me an opportunity to survive. thrive. And I owe them a debt of gratitude for that, because I gave them all the reasons in the world to fire me. And I gave them all the reasons in the world to not want to help me, to say, well, he's getting what he deserves. But they didn't do that. They took care of me, and I'm grateful for it. It brings us to the point where I get out of the hospital setting and get back home first part of January 2023. And I know at that point that I'm through with the IV drugs, methamphetamine, cocaine, heroin, whatever. I'm done with that. But all these consequences, I still can't give up the drinking. I still can't give up the pain pills. I still can't give up the marijuana. And so I'm home for a few days, and then I'm back at that. I can't even drive very well because my right foot's been removed. I don't have a prosthetic, so I can't get my resources hardly. And but I figure out a way to get that, and I'm miserable. I console myself by saying, well, you're not doing hard drugs, but you're drinking. You're not using marijuana for a pain control issue. You're using marijuana to get high. You're not appropriately using the painkillers. You're chopping them up and snorting them. I might not be shooting them up at that point, but I was taking them illicitly, inappropriately. Here I am, I've lost a leg. I've lost everything. I have really no more resources left. I've depleted portions of my retirement account to buy drugs with. At this point, people aren't lining up to come help me. They've had enough. I had a couple of friends that showed up. One was an old nurse that had worked for me years ago, hadn't worked for me in years. And then one was my youth director from when I was a little kid. They don't even know each other. They show up.
At the same time?
Pretty much, yeah. I mean, I was, impaired, drunk, high at my house. And for whatever reason, they show up. They know I'm struggling. And I go to a crisis center for a mental health evaluation. And once I get back home, I'm trying to reconcile where my life has gone wrong and what am I going to do moving forward. All of these terrible things happen, they're consequences of my behavior. They started when I was in my 20s, and now I'm 53 years old, and they're still going on. And I'm still not willing to say enough's enough. I don't know at what point am I going to have enough or hit rock bottom. So an interesting thing happened. Some of the guys I grew up with from high school, some of them I went to college with. We'd get together 2 or 3 times a year there in my hometown, and we would have dinner, catch up, talk about old times. We'd done it 2 or 3 times. I'd gone a couple of times over the last year or two before the amputation. So these guys are not alcoholics. They're not addicts. They're functioning members of the world. And we would go, and we would always have a nice time. Usually wives, girlfriends would come. Always there would be a drink on the table. Nobody got drunk, but everybody was, a lot of people would have one cocktail or one beer. It wasn't a party situation. It was just dinner and good company. So on February 3rd of 2023, this group got together and a planned get together. There's about 10 of us that show up. I can't drive at this point. I don't have a leg. I don't have a prosthetic. And so one of the guys and his wife come to get me. I'm nervous at this point because I'm self-conscious about going out in public without a leg. I'm still intensely concerned about what other people think, which is very unhealthy. But that was just the state of mind I was in at the time. So they're coming to pick me up that evening. So I spend the whole day smoking marijuana and drinking whiskey. They pick me up a little early because my friend had to help me. I was in a wheelchair. He had to load my wheelchair into his car. So he gets there a little early, take me to the restaurant. So we get to the restaurant first, and there's a table for 10 or 12 people set up. And so I roll up to the table. And the waitress comes, and I order a glass of whiskey. She brings it out. Then over the course of the next few minutes, everybody else shows up. Everybody's visiting, catching up. We hadn't seen each other maybe 6-8 months. And I have a realization of 2 things. One is that these guys they're not talking about the old days back in high school or college. They're talking about what's going on in their lives currently. They're vested in each other's lives. They know what each other's kids are doing. One of the guys was getting ready to be a grandfather. One of the guy's daughters is getting ready to get married. The other one's daughter was graduating from a nursing program. But I don't know about these things because I've been out to lunch for so long. I noticed that. And it was almost like I had this surreal moment. And the second thing I realized was the key moment. I realized that the only person at that table that particular night that was drinking was me. Everybody else was drinking tea or water. Again, that wasn't a big drinking club or a drinking group, but previously there had always been a beer or two on the table. We've met 2 or 3 times since then, and every time there was a beer or two on the table. But this particular night, the only person was me. And I became acutely aware of that. And something in me said, I want whatever it is that they have, this awareness of what's going on around them with their family and the family of their friends. And they don't have to drink or drug to have a good time to do it. And I thought it may be too late for me at this point. At this point, I was 53 years old. I thought maybe it's too late for me. But I told myself I want to find out. And that was rock bottom. All these other catastrophes over the past 30 plus years, not all catastrophes, but all these other significant moments that a lot of people would view as significant consequences, weren't consequences for me, but that was. That was the realization. And that's where it started. I'm not saying it's been easy every day since, because it hasn't been, but it's a point where I could start the process of sobriety. That was the last drink I had.
That's interesting. That was February 3rd?
Yeah.
When you talk about consequences, right? Consequences only matter if what's taken from you matters to you. And I know your ex-wife and I know your kids and I know they mean the world to you and they're fantastic. So it's not a matter of you didn't care there, right? Your focus was somewhere else. And maybe it was primal. Maybe it was, just addiction speaking. But it's interesting that what it says about a person, and I don't know, we'd need Jordan Peterson to help us sort this out, right? But if you lose your wife, you lose your kids, you lose your job, you basically lose your parents, you lose your brother, right? You lose your finances, you lose all these things. But the one thing that was a wake-up call from what I'm hearing is you didn't want to lose a connection.
Yeah.
Maybe it wasn't just a connection to those guys, but it was just a connection to life. Disconnecting from all those other people for whatever reason at that time in your life, you couldn't see the value. But, if I took that watch from you, it doesn't matter to you that much, right? There's not any real consequence. You take these things, but interesting to know, when we don't know, we'll probably never know, but just that sense of connection, that sense of being a part of something hit you that night.
Yeah.
One of the things we talked about the blue zones, one of the things, I don't know if you remember, but there's those 9 and one of them was the purpose, right? The plan de vita. And that's real, and kind of a sense of being a part of something bigger than yourself, or like the Moais where they're sort of tethered to a group of 5 where they all get together, every night, maybe for life, maybe for 70, 80, 90 years, maybe 100 years, right? They get together. I think maybe initially set up for finances so that, if one kind of had problems, the other would be there to help them. But when you look at, when you look in Okinawa, and I don't know that it's still the way, right? I mean, I think Okinawa is kind of falling from the blue zone, but it's probably more the surrounding villages. But those women get together, and probably men as well, and they rely on each other. And there's just that sense of connection.
Yeah.
It's very real. And I think if we have it, it serves us and it gives us something to look forward to, but it also gives us an accountability.
Yeah.
And the other thing that I think is just remarkable, and I think is definitely worth extracting from this story from a health and fitness perspective, is it's never too late, right? It's never too late. So often, we see it. I mean, you just look at statistically, the rate that people recede on weight loss. They lose weight, and then they go back, and they lose weight, and they go back. And usually when they go back, they go higher, right? And it just happens over and over and over again. And there's got to be some frustration associated with that. But it's okay. It's not okay. You don't want to fall off. But when you do, you got to get back up and you got to go, right? And you got to start re-implementing those things. It doesn't matter what it is. If it's working out, if it's diet, if it's addiction. And I mean, it's extremely courageous of you to share this story.
Yeah.
I've heard most of it. But man, what a path.
Yeah, I have a life today that I never dreamed I could have. I mean, I have a heart full of joy. I'm content. And my contentment is not based upon things I have or money in the bank. All those things are by and large gone. But I wouldn't trade the life I have today and the joy I have today for any of that. And I never thought, even 2+ years ago when I first started getting sober, I never thought I would be that person. I thought this contentment was only for you. I thought it was only for somebody else. I thought that I had to augment that or manipulate that or accentuate that with drugs, alcohol, sex, gambling. like what you said, a hit of dopamine, something to make it better. I never thought I could just take life on life's terms like I've been able to these last 27 months. The same hospital that had to fire me, the same CEO that had to fire me, who was a friend, at one point in my career. I had behaved so poorly. Even their grace that they extended to me in my hour of need is almost beyond measure. And then the sizable hospital debt that I incurred following the amputation, they forgave it. I reached out to them. I had no mechanism to be able to repay it, and they forgave it. And that's bigger than me. I didn't deserve that. I mean, my behavior was abhorrent, and I know that, and I own that. I serve on a committee at the hospital. I mean, this guy has reached back out to get me engaged, not as a doctor, but just as a member of the community on a committee at the hospital, just to be decent.
Bring you back into the fold.
Exactly, yeah.
But, it's so good to pay it forward, right?
Yeah.
They're paying it forward, but you're paying it forward.
Right.
To your point about, you always wanted something more. What I always tell the kids, it's one of my favorite quotes, is contentment is wanting what you have.
Yeah. That's good.
It's good.
Yeah.
But if you can get to that point in your life,
yeah.
It doesn't get any better than that.
Yeah.
There's always a societal push for more and bigger. It's not always bad, but it's not always good either.
Yeah. One of the greatest joys that I've been blessed with here is the ability to stay in my own lane, meaning I'm truly happy with what I have. And if somebody else appears to have more, I'm happy for them. And I never used to be that guy. If I had this and you had something else or something that I perceived to be more, I wanted that.
Right.
That was the kind of life I led for many, many years.
So one last thing, I'm vaguely familiar with the 12 steps. There's varying levels of overweight and obesity. I mean, obviously there's the, overweight, and then there's, stage 1, 2, and 3 obesity, right? I'm not talking about that. But clearly, if you're a few pounds overweight, maybe you just have bad eating habits. You don't exercise. You're just kind of not doing the right things, the right lifestyle. But probably if you're 300 pounds overweight, there's more at play. Maybe some psychological issues that you're dealing with. Maybe you don't even know you're dealing with them. Maybe some childhood trauma. I guess what I'm saying is there's probably some issue that is not different maybe from the alcoholic. It just manifests different. And unfortunately, it manifests where everybody can see. Not only were you functioning in society, you were functioning at the top end of society. And most people didn't know. But people who are obese don't have that luxury, right? We can see them. We see the manifestations of whatever it is. We know that people who are obese and have gastric bypass, they have a 5 times higher successful suicide rate because you can't surgically extract what psychologically is creating their problem. You can alter their gut so they eat less, absorb less, and lose weight, but that issue hasn't been dealt with psychologically. We know that as a fact. And so I think it's very important when people go in for gastric bypass or, that they make sure that that's been dealt with. And sometimes it has and sometimes it hasn't. But the question is there a role, and you don't have to go in detail, but just broadly, is there a role for the 12-step program for obese patients?
I think so. Those principles would apply. They're initially designed for alcohol and then piggybacked over into narcotic abuse. Absolutely. There would be a role there. The unmanageability of that program, the powerlessness people feel. I can imagine over the past 2 years as I started to try to take back my health, sober, but I wanted to be healthy. I applied those principles. I applied that process, that same process that I used to get through alcohol and drug addiction and continue to use to stay away from that. I applied those principles. So I think that there's a role there in the 12-step program. And I have a great deal of compassion for people that struggle with, let's say, a food addiction or an abnormal eating situation like that, because you don't have to drink to survive.
That's right.
But on some level, you have to eat. You have to consume calories.
That's right.
The sympathy comes from this perspective. If you told me that I had to drink alcohol just a little bit on a daily basis, but not too much, that would send me into a full-blown panic attack.
Right.
To expose myself to what was at least one of the greatest symptoms to my problems would terrify me. And so I can imagine somebody that struggles with an eating disorder or a food addiction, and all of these different weight loss programs have failed for whatever reason. That would be terrifying. That'd be terrifying. I mean, you have to eat.
You can go cold turkey on alcohol, drugs.
Absolutely.
Right? You can, if not immediately, you can eliminate them 100%.
Right.
But you can't eliminate nutrition.
Yeah.
Well, I appreciate you taking the time to share. I want to have you back, and we'll talk about how you got from there to here.
Absolutely.
I know maybe on the next one we can talk about, last time you were 30 months sober. Mm-hmm. Now you're 27.
Yeah.
I have no doubt that you're going to continue to make it, but I know that for you, it's a daily conversation that you have with yourself.
Absolutely.
So that's where this story ends. But then the next phase of your life is this health and wellness journey that you're on. Oh. And we'll do that on the next one.
Okay.
Because it is fantastic, the turnaround that you've had. It's just an ongoing battle. David Goggins says there's no finish line, right? It's just one perpetual race.
That's right.
I'm your host, Dr. Drew Crawford. Join me next week as we go beyond measurements and image and build healthier lifestyles and elevate your well-being on the BMI podcast. See you then. The BMI podcast is provided for educational and informational purposes only and does not constitute providing medical advice or professional services. Be sure to check out our description below for our website and social media platforms.